Welcome. Today's topic is COVID-19, an employer's perspective. Carl Albrecht here from Australian Work Health and Safety, 2 times winner of the Wasabi for Excellence in Workplace Health and Safety. I hold a Master of Science degree in Occupational Safety, Health and Environmental Management from the University of Western Sydney, a Diploma in Logistics Management, and I'm a Chartered Generalist OHS Professional Member of the Australian Institute of Health and Safety. Under health and safety law, employers are described as the person conducting a business or undertaking, also known as a PCBU, a PCBU, and a probably could be you. So throughout this webinar, whenever you hear PCBU, it's a reference to the employer. And the employer, or PCBU, holds the primary duty of care. They must eliminate hazards so far as reasonably practicable, or if not reasonably practicable to eliminate hazards, they must minimise the level of risk to as low as reasonably practicable. So the aim here is not to make every workplace completely pure, sterile and devoid of all possible hazards. What it is about is managing the level of risk to as low as reasonably practicable. ALARP. So some examples of what a PCBU must do include the provision of a safe work environment, sufficient lighting, adequate ventilation, floor coverings in good condition, that emergency services can get in when needed, and equally that workers can get out during an emergency. Plant is any machinery, equipment, appliance. Structures can be towers, masts, dam, bridges, jetties, pipeline, a pump house associated with a pipeline, all come under the category of structures. And a safe system of work is more than just safe work method statements. A safe system of work includes a method to report hazards and incident, a systematic approach to the provision of training and PPE, emergency preparedness, all comes under a safe system of work. Substances can be gas, solid or liquid. Plant structures and substances must be safe before, during and after use. Facilities includes toilets and lunchrooms, and during COVID-19 they will require special attention. Provision of information, training, instruction and supervision is paramount. It is unacceptable for workers to work in ignorance. They must know what they need to know. Also, the health of workers has to be monitored, and that includes tests like lung function, eyesight, skin checks. The amount of lead in a worker's blood in some workplaces has to be tested. Conditions of the workplace could include conducting air quality checks, assessments of noise and lighting. Duties are not one-way traffic. Workers also have duties. Workers have to take reasonable care for their own health and safety and for the health and safety of others. They must comply with reasonable instructions and cooperate with reasonable policies and procedures. So all the knowledge provided during this pandemic must be followed by the workers. Non-workers also have duties very similar to workers that the non-worker has to comply with. So, requesting somebody have their temperature taken prior to entry to a workplace is a reasonable request. PCBUs retain the duty to consult with their workers about changes that could affect their health, safety or welfare. Remember that the financial arrangement has no bearing on this duty. Consultation must be meaningful and effective, never a superficial approach. So this includes sharing relevant health and safety information such as safe work method statements, manufacturer's instructions, servicing schedules, legislative updates, and of course information about COVID-19. Workers have to be given the opportunity to have their say and contribute to decision-making process, which fosters a team approach to the management of health and safety. Now, on balance, the PCBU does not have to agree with every recommendation workers make. What they do have to do is take those requests into genuine consideration before making any decisions. And the PCBU has got to advise the workers of the outcomes of the PCBU's deliberations. Many WH issues will need to be decided promptly. Nonetheless, PCBUs must consult with their workers on any changes or proposed changes to plant, substances, structures, methods or procedures. As I was told many moons ago, pride and perfect preparation prevents performance. So we need to plan. We need to have contingencies in place so our organisations can be flexible enough to cope, such as with absences. How will we manage our suppliers or their non-performance? And there is very likely a raft of other possibilities we need to be prepared for. The next step is implementation. PCBUs must have a planned approach to keeping their COVID-19 knowledge up to date. Importantly, always dealing fact, not in fiction. So take your staff on this journey with you. Keep the lines of communication open. Very importantly, communicate closely with your commercial cleaners. A key WHS duty is the provision of resources. Resources are anything physical, financial or human necessary to manage health and safety. Some of the social distancing protocols we have become used to will be necessary at workplaces. Hot desking, which is prohibited in the United Kingdom, if continued, will need specific attention. COVID-19 recently became a compensable illness, and I'll highlight this later, and there must be consistent provision of hygienic supplies. Revising all activities is essential, as is providing knowledge. Should PCBUs have to provide information on hand washing? The simple answer is yes. You have nothing to fear but fear itself, said Franklin Roosevelt, who was a USA president in 1933 during the depths of the Great Depression. Keeping staff well informed about COVID-19 will dispel myths and the spread of misinformation, allowing workers to be well aware of their circumstances. One way to do this is to provide information, such as this COVID-19 Identifying the Symptoms chart, downloadable free of charge, which compares the differences between COVID-19, the common cold, and the flu. The definition of workplaces is very broad. Company vehicles are undoubtedly workplaces and therefore require their own cleaning protocol. For example, it is highly recommended that air conditioning be set on fresh air and never to use the recirculating setting. Proactive PCBUs are appointing a COVID-19 champion to advocate good COVID-19 responses, so make sure they have clear roles and responsibilities and adequate resources. Part of COVID-19 risk management will include vulnerable people in the workplace and what is the best course of action for them. The Australian government has prescribed those who are vulnerable to the COVID-19 virus. Cleaning workplaces is critical to the effective management of this pandemic. To maximise the effectiveness of disinfectants, barriers must be removed. The workplace must be thoroughly cleaned before disinfecting. It does not matter whether the disinfecting is being done manually or mechanically, such as with a fogging machine. Also, attention must be taken to the contact time the disinfectant must remain on the surface. Some disinfectants require 10 minutes of contact time. The longevity of the virus on surface varies greatly depending on the medium it is in, cleanliness of the host surface, and climatic conditions. Professional cleaning is preferable. PCBUs must ensure their cleaning contractors are professional, competent, and with a proven track record. The cheapest quotation is unlikely to be the best option. Professional cleaners will conduct their own assessment of the workplace, categorising surfaces into 2 or 3 classes with appropriate treatment for each. PCBUs, whilst not expected to be professional cleaners themselves, should at the very least be discussing this with their cleaners. Food is unlikely to be a transmitter of the COVID-19 virus, and there is no proof as to whether or not COVID-19 will exist in sewage. Therefore, precautionary measures must be taken. When returning to work from isolation, those who have not had symptoms do not require a medical clearance. Workers who have had symptoms must obtain a medical clearance. So, soap and water or hand sanitizer. This virus has got 2 parts, the outside or protein coat and the inside where the DNA or RNA genome is. Water is very efficient at breaking down the outer protection, allowing the soap to act on the genome. Should you use an antibacterial soap? The fact is COVID-19 is a virus, not a bacteria. Often we see claims that hand sanitizers will kill 99% of germs. Hand sanitizers will only kill viruses when they are between 65 and 90% alcohol. Other ingredients can include water, moisturizers, or aloe vera, and so on. Oddly enough, when your parents said to wash your hands, they knew what they were talking about. It is far less likely they would tell you to wash your hands before smoking. Of course, they just told you not to smoke. The act of smoking brings a hand very close, if not touching, the mouth. Interestingly, studies show that humans can touch their faces with their hands over 20 times an hour. Making a conscious effort to minimise touching our faces minimises the chance of infection. One of the areas of greatest debate has been the wearing of masks. Different masks have different purposes. Many surgical masks are for the protection of the patient and not of the surgical staff, and this is in part because some surgical masks do not make an airtight seal on the skin that is required for respiratory protective equipment. Be aware that all PPE in workplaces must comply with the relevant Australian standard or equivalent. That said, there has been any number of forgeries and non-compliant masks making their way into the Australian market. A major Sydney newspaper ran an article on this recently. It is the responsibility of the PCBU to make sure all PPE is fit for purpose, the correct size, replaced where necessary, and provide knowledge for its use. During this pandemic, governments across Australia have passed legislative amendment bills. In New South Wales, a COVID-19 diagnosis will be compensable in many industries. It will not be the responsibility of the worker to prove the workplace was a substantial contributing factor to the illness if they are in one of these prescribed industries. Thank you very much for your attention and be safe.